So the presentation that I took part in was around a more local kind of service delivery model, which involves more recently pharmacists. But the Improving Cancer Journey is an integrated model based in local authority, but delivered through a sort of multi-partnership approach. NHS, third sector, local authority, Glasgow City Council in particular, and community GP, pharmacy staff, district nurses, etc. And the appointment of link officers is when someone has a diagnosis of cancer. Through ISD, they're automatically sent a letter inviting them for a holistic needs assessment. And the link officer will see that person either at home, in a library, in a GP surgery, whatever is sort of suitable for the person themselves. They will also see their carer as well. The person with a cancer diagnosis would identify their main concerns, whether that be emotional, practical, spiritual, housing, whatever. And that link officer will support that person by either referring them to a multi-agency, sort of people that are out there providing services, or signpost them to an appropriate service. And I suppose for us that the community assets that are out there in Glasgow, the referrals have been made to about 260 services. So actually these services initially thought that we're going to be overwhelmed with people, but actually with the expertise of the link officers, they identify the absolute service that person needs to be referred on to, and that person is supported. Where the pharmacies come into it, more recently we've been looking at working with GPs around maybe potentially inappropriate referrals. If people were referring to the GP for things like itchy skin, dry mouth or whatever. And then through discussions with our local pharmacy team, actually there's an intervention there that can be supported by the pharmacists. So we've developed a pilot project which is just about to go live, which is looking at primarily in the south of Glasgow, patients with a lung cancer diagnosis. And the purpose of doing it as a pilot is just again to test the model and to work with the pharmacists. Macmillan has supported the pharmacists through some in-depth training and making awareness around cancer awareness, and also the locals, so the Improving Cancer Journey, were able to support the pharmacists to understand the role and remit of the link officer, the community assets, and the purpose of the model. And I think that has gone down very, very well. The pharmacists are really keen. And the purpose of that is that the link officers will refer the person to the local pharmacist, who will then support the person with a medication review in either probably the GP surgery, but it might be someone that's more appropriate for that person. And again, provide support for that person. Because we've built up a good relationships with the GP, the acute oncologist pharmacists and the community pharmacists, then if that pharmacist feels the person actually does need to be referred back into the GP, there's a warm referral made, and vice versa with the acute oncology pharmacist. So again, looking at that integration, looking at the remit and the support that's out there, and just working across the boundaries of acute, community, primary care, and I think it's going to be a very positive outcome for the person, which is at the centre of that model.